Welcome to this introductory presentation of individualized supports for students who are deafblind. This initiative was developed through a collaboration between the New Jersey Department of Education and the College of New Jersey. There are 5 modules in this series. This is Module 2, what you need to know about vision impairment. And we will begin. The visual system, think about when you, I have to go back, sorry. When you consider the human visual system, think about the relationship between the eye and the brain as compared to the relationship between the video camera and the television monitor. The eyes are like the camera, and the television monitor is like the brain. If your vision is like this and nobody knows it, and you don't have the ability to tell anyone, how would you learn? What would be interesting to you? How would you know what someone is talking about? What would you be reaching for and exploring in your world? Would you feel secure? Vision impairment is not simply about seeing or not seeing. Vision develops. And babies at the time of their birth do not have a fully developed vision system. It's continuing to develop within the first few years of life. So when a baby is born, they can see light and they can see some gross shapes, but there is very little to no clarity. In this photo, this is approximately what a newborn sees. At approximately 1 month of age, a child should blink at a flash of light, turn his or her head to follow faces that are near him. This is what an infant sees at about 4 weeks of age. At 2 months, a child's attention can be briefly drawn to objects up to 6 feet away. This is approximately what an infant sees at 8 weeks of age. At 3 months, a parent should see a baby begin to kick and wave his arms in anticipation of food, because they're able now to see the food coming. So this is what a 3-month-old might see. At 6 months, a child should be reaching for things that catch his or her interest, differentiating faces within 6 feet of distance, and watching things drop. This is what a 6-month-old sees. Let's turn our attention to visual impairments. Optical visual impairments impact the clarity and scope of what a child is able to see. This is what a person with 20/20 or typical vision would see. The image is clear and the person is able to make out all the fine details in the photo. This is what a person with an acuity loss might see. And what's important to know about acuity loss is there are varying degrees from a little bit blurry to very, very blurry. There is also an issue of scope and span of what a person can see. This is known as visual field. A normal visual field should span about 180 degrees. A person experiencing a field loss either experiences blind spots, also known as scotoma, or peripheral vision field loss, field vision certainly not a full 180 degrees, or central vision loss, central visual field loss. Another type of ocular visual impairment are ocular motor deviations. These are known as muscle imbalances. The umbrella term for all ocular motor deviations is called strabismus. This is a misalignment of the eyes caused by ocular muscle imbalances, and there are several types. The most common types of strabismus are esotropia, when there is an inward turning towards the nose of one or both eyes. Exotropia, which is an outward, away from the eyes and towards the temples, turning of the eyes. Hypertropia is an upward turning, and hypotropia is a downward turning. This can occur in one or both eyes. In the case of folks with esotropia, the inward turning, or exotropia, oftentimes the image is that they are able to view is a double image. Imagine seeing double. Imagine the first grader who's trying to write their letters on the lines of the paper when they see a double image. Figuring out where the lines are can be very difficult. There are also visual impairments that are referred to as cortical visual impairments. These are also known as cerebral visual impairments. The problem is not with obtaining a clear image, but the problem is with processing of visual information through the through the visual neural pathways all the way to the visual cortex of the brain. So what is cortical visual impairment? In the upper right-hand picture diagram, you see the primary visual cortex, and there is a primary visual cortex on both hemispheres of the brain, right and left. Cortical visual impairment is a dysfunction in the visual cortex of the brain, as shown in the picture, or along the visual pathways from the optic nerve to the brain. The lower photo on the slide shows the optic nerve in the back of the eye, and this is where the process begins to the brain. And cortical visual impairment can occur anywhere along that path to the visual cortex. What do children with cortical visual impairment experience? Christine Roman Lansky in 2004 described it this way: having a cortical visual impairment is something like trying to find your mother in a crowded stadium. Unless she is wearing something that makes her stand out, you will not be able to see her. So that gives us a big clue about how to address the support needs of a child who is deafblind, who is experiencing cortical visual impairment. That visual distinction, visual standing out, visual high color contrast is absolutely essential. Behavioral indicators of infants with any type of vision loss. Child may have typical looking eyes and eyelids or not. There may be some difference or not. Child does not respond to faces or smile, is not smiling by age 3 months. The child does not excite at the presence of a bottle or other favorite object at 3 to 4 months. The child does not follow objects or people by 4 to 6 months. The child does not turn his or her head at unusual, or turns his or her head to unusual positions to view objects. So they may do a twist or a turn of the head or the neck in order to look at something rather than looking at it straight on. The child holds objects exceptionally close to the face to view, and the child may reach inaccurately, reach and miss past the age of 6 months. Before the age of 6 months, we see that, but by 6 months, they should have a visually guided reach and be able to reach accurately. Any degree of vision impairment or total blindness can cause motor delay. And the primary reason is not because there's something wrong in the motor system, but when you can't see things far off, why move? A baby picks his or her head up because something has intrigued him. It's been captured by his vision. These children can also experience language delay due to an insufficient or absent context for understanding words. Words become understandable because visual associations occur for sighted children. Cognitive delay is a risk in terms of limitations on meaningful input. Just like language development requires thousands of exposures to the language itself for the child to catch language, meaningful input paired with cognitive concepts in the environment, visual input, is absolutely essential. And without accommodation made for the vision impairment to assure meaningful input, the child will experience a cognitive delay. Health or feeding issues, well, there could be limited interest in exploring a variety of textures, exploring new foods with limited visual reference. Vision is the trigger in sighted children that create their interest in food and in other routine activities. Child may also experience sleeping issues, mixing up day and night without the visual reference of seeing the sun come up in the morning and go down in the evening. Red flags regarding vision loss. Does light seem to bother the child? Does the child tilt his or her head when looking at objects? Does he or she hold objects very close to the nose or to the face? Does the child seem to be looking under or over or to the side of an object rather than directly at the object? Does the child tend to ignore objects unless they move up, down, or unless they make noise? The IDEIA definition of visual impairment is under the federal law, special education law, is an impairment in vision that, even with correction, adversely affects the child's educational performance. This definition is broad, as you can see, and includes those with total blindness or partial sight, also known as low vision. Critical factors influencing the overall effect of vision impairment. The age of onset of vision impairment. If the vision impairment occurs under the age of 18 months of age, the child may have insufficient visual memory to remember cognitive concepts. The degree and type of vision impairment. Well, knowing the degree and type, the degree of vision impairment and the type influences how we will support that child. A child with a field loss is supported in a different manner than a child with an acuity loss. It's also important to note whether or not the vision impairment is stable or whether it will change over time. This is an absolute critical bit of information to know in terms of planning for future support. Will this child initially learn print for reading and later require Braille? The law states that if the child has a progressive loss, Braille instruction must be provided at some point. And educational intervention. We can decrease the impact of vision impairment by providing the appropriate supports, the appropriate instruction, the appropriate educational tools for the child with vision impairment. How does visual impairment impact interaction and learning? Well, the relationship between the child and other people may be disrupted. There may be missed emotions, missed joint line of regard in terms of overall communication. And the sequence of conceptual development may differ from that of sighted children. There is a tendency for children who are blind or visually impaired to experience conceptual development that is commensurate that with which they can hear and touch first, and then other concepts later. Orientation, mobility in the environment are also impacted. The ability to move safely through the environment, but also to understand one's body in space, which actually comes before the movement part. And that's an absolutely critical factor. Some environmental accommodations for all types of visual loss. For students with partial sight, low vision, we can increase the color contrast of materials. We can also provide safe supplemental lighting. We can also take steps to manage and reduce glare in the environment. And we also need to pay special attention to figure ground relationships. What if we want them to look at our faces as teachers or look at the materials that we're presenting, we must always consider what's behind the object that we want them to focus on. Instructional accommodations for vision loss may include adjusting the size of the material, the format of the material. Some very complex materials with textbook pages with text boxes and things like that may need to be reformatted for a child with vision loss. Preferential seating and adjusting the distance. Color contrast, figure ground, as we mentioned before. Braille and all manner of tactual access may need to be provided. We also may need to consider the sign language space. Generally speaking, for children with acuity loss who are sign language communicators, we may need to be closer to the child in terms of where we present the signs. Children with visual field loss may or may not require the sign language to be presented farther away or in a smaller signing space. A word about color contrast. Why is it important? How can we use contrast to make things easier to see? Just like on the checkerboard, we can denote the black squares from the red squares because they are of high color contrast to each other. Happiness is a warm puppy. Using light-colored fonts on light-colored backgrounds is not a very good color contrast. Oops. So we change the background if we want to keep the same color font. And using a dark background with a dark font may be a little more difficult to see. So we always have to make sure that we have, if we're using a light background, a dark font, or if we're using a dark background, a light font. Which stained glass picture has greater clarity? Take a moment and look. What do you think? I'm going to say probably the one on the right, where they have taken the shapes and they have outlined them in dark pen. It automatically increases the clarity and the distinction between the shapes. Reformatting context or content to support visual access. This serves to reduce visual clutter and confusion. Whenever a page is broken up by text boxes and some creative formatting is used, it may be necessary to simply reformat. This is true of students who are low vision print readers, as well as students who are Braille readers and are accessing the material through Braille through textual means. All of this serves to improve access. Reformatting for visual clutter for the low vision child allows that child who with vision impairment or deafblindness to better access the material. Again, reformatting content to support visual, to foster optimal visual skills. Sometimes when text is arranged in columns, a child with visual impairment will not necessarily scan down one column and move back up to the other. That child may scan across all columns, and therefore the meaning is lost and thoughts become incomplete. Removing columns and formatting for continuous text will allow the child to use optimal scanning skills by allowing full scanning across the page. The child could also, in the case of material that can't be reformatted to continuous text, child could use a reading guide to isolate one column at a time. And a reading guide can be nothing more complicated than a piece of cardboard or construction paper that allows one column to be seen at a time. Reformatting content to support visual access. Again, reformatting can enhance comprehension of tools like graphic organizers or concept maps, especially for a Braille reader, but also for some students who are low vision and reading print. A linear arrangement of this type of tool may be more accessible and meaningful to the student using large print or Braille. And it's totally individual, and decisions about this kind of reformatting would need to be made based on the student's needs as well as the arrangement of the tool. And that's it for what you need to know about visual impairment. I think it's the end, but it's also a good beginning for you. Stop recording.